Today I'll be giving a presentation on a plan that I believe will help eye correction costs in the near future. Imagine depending on eyeglasses or contact lenses every day of your life. Then imagine learning that there's a procedure called LASIK that can help you decrease the dependence on uh, these these tools to help you see every day. Whether you're a student, a parent, or just a regular construction worker at a construction site, but you depend on this every day, it must mean it's very costly for you and this can affect you. The fact that LASIK is considered an elective is normally means a lot of health insurance companies do not provide costs for this. Nor do they provide partial payments. They want patients to rely directly on themselves to pay for this. I feel insurance companies should offer partial payment. When you think of health insurance, patient safety should ring a bell in your head, right? So I'm just wondering, why is that not included like partial dental plans? Many qualified patients cannot seriously consider LASIK due to the cost. Just like the U.S. Food, Drug, and Administration described, surgical procedures intended to reduce the dependence of eyeglasses and contact lenses. And the American Academy of Ophthalmology also explains that LASIK basically is just a surgical laser procedure that reshapes the cornea. It can help nearsighted, farsighted, or patients with astigmatism. Also, patients must receive an accurate information and limits and risk to LASIK. So, not everybody, in many cases, are a possible candidate for LASIK. You have to be a possible candidate for LASIK due to the fact that LASIK can also come with some conditions, or should I say, later side effects. Some people have complained of constant dry eye. Some people deal with halos. Some have said in certain cases they see blurry vision. And, difficulty definitely seeing at night. Night is already dark. However, the FDA warns that LASIK has possible, side effects. But despite those side effects, however, patients are supposed to go in and have a speak with their physician and, give them everything. Give them their ocular history. What have their eyes been like? Have they been seeing some complaints? How did they hear about this? Did you hear about this? Did you see a brochure? Did someone, say, hey, you should look into LASIK, or someone like me who's always giving information that I learned when I was in the ophthalmic technician program. The reason I brought this today because I am an ophthalmic technician, but the reason I chose this subject because I want to pursue my career in the ophthalmic technician in the ophthalmology field, and the cost of care, eye treatment, and the barriers that people are facing to get help, is a concern of mine. And at any moment, if, I can give any information or help those who aren't aware, I want to let them know, but I also more concerned about, how we can help those who aren't more so aware of this procedure, as well as those who cannot afford this procedure, so they won't even consider looking into it. However, I want to talk about how insurance companies can help. First, I feel like they should be able to present this future procedure. This policy should be gradually evaluated, and as well as given to patients and pilots who qualify for this. So members who do qualify for LASIK, they should be offered definitely a partial payment insurance policy. The fact that the results can be measured by the number of patients using the benefits. Also, patient satisfaction. Patients can give reviews letting you know, hey, this worked, this didn't work, this was helpful. I paid for this and I'm experiencing this, but am I still acceptive to the program? I feel like that will be helpful, and over time, maybe with a 3 to 5 year span of, certain patients who do qualify having the option to leave a review, so you can know that this is effective and how well it is helping patients who have, opened up to this proposal of health insurance of partial payment, partial being paid by the healthcare and partial being paid by the patient themselves. Also, this proposal, is mostly realistic because it does not, require insurance or immediately provide unlimited full coverage. It's just a short term, 3 to 5 year plan that we can offer people to see how well this actually helps them. Most of all, in conclusion, LASIK can definitely reduce the dependence of glasses and contact lenses, but we also have to consider the fact that partial payment will be much more ideal for patients who cannot afford it, as well as looking into the idea of healthcare insurance, basically allowing these people to over time to figure out, hey, is this something I can do, or hey, this isn't something that I feel like is helpful, it's still too costly. As well as patients and employees, they should be able to review the plan. Like I said, they should have a great breakdown of what this plan offers, as well as what to look forward to after the procedure from the physician itself, himself or herself or themselves, to explain what they expect. Once the patient, I'm give thinking that, once the patient explain what they're looking for, and once the doctor explain what the possible side effects are, if any, I feel like patients should be more than open to having better vision. Who doesn't want better vision, and who doesn't want to prevent the cost of paying for something yearly that they barely cannot afford? Most of all, I also feel that, hey, even though some people can afford LASIK, they should not be completely excluded from those who get the invitation to a partial payment, because those people who do make nice amounts of money still, however, have other things that they may have need to pay for as well. Families are struggling right now in this time, and right now we need to help those who need help as much as possible, because eye care is serious and many people can do better, and it can prevent limitations in life and help those who need it. Thank you.